in the southwest corner of the bedroom. I also collected a bottle of prescription medication prescribed to the descendant, a spoon with a white crystal-like substance in it, a rolled up piece of white paper from off the counter or from off the top of a counter along with east wall in the bathroom. I also collected remnants of a white powdery substance from out of a drawer and from the bottom of a mirror in the same drawer in the bathroom counter along the east wall of the bathroom. We know Whitney Houston was not going to the hood to buy cocaine, y'all. Who was her supplier? I later booked all of the bottles of prescription medications, the bottle of supplement, all of the blister packs, all of the loose tablets and capsules, the spoon and white powdery substance at the Forensic Services Center as evidence. Why? Where is the goddamn the fingerprints for everybody that came in her room? On Saturday, February 11th, 2012, at 23:42 hours, a criminalist Mark Schuller, or whatever his name is, used a pubic hair kit on the descendant at the scene. On Saturday, February 11th at 23:55, criminalist Mark Schuller collected fingernail clippings from the descendant hands at the scene. On Sunday, February 12th at 04 hours, criminalist Mark collected hair standards from the descendant at the scene. On Sunday, February 12th at 1500 hours, criminalist Mark used a sexual assault kit on the descendant at the scene. Criminal Mark later booked for the public hair kit, the fingernail clippings, the hair standards, and the sexual assault kit at Forensic Service Center as evidence. Body examination. The descendant is a 40-year-old black woman with short black hair, brown eyes, as she has all her natural teeth. There's an old, healed, vertical scar approximately 2 inches in length on her inner lower left arm. No other scars, no tattoos was noted. The descendant was nude, lying supine on the living room floor. The top of her head was facing south. Her right arm was bent at the elbow with her right hand resting on the floor against the right central portion of her torso. Her left arm was slightly bent at the elbow with her left hand resting on the floor against her outer upper left thigh. Both of her legs were straight with her right foot pointing north and her left foot was pointing northwest. There was a defibrillator patch on the upper right side of her chest, and there was another defibrillator patch on the left center portion of her torso. Both her eyes were congested, and there was a bloody purge coming from her nose. There was 2 superficial abrasions to her left side of her forehead, and there was a superficial abrasion to the left side of the bridge of her nose, like somebody beat her up. There was a superficial abrasion to the top of her right shoulder. There were minor skin slippage to the upper central portion of her chest, to the inner left central portion of her chest, and to the lower center portion of her chest. There was a minor skin slippage to the upper left side of her abdomen. There were superficial abrasions to her out lower left arm. There was a possible old puncture wound to her inner left elbow. There were superficial abrasions to her inner central left forearm, and there were minor abrasions to the top of her left hand, between the middle and ring fingers. There were minor skin slippage to the front of both of her knees, between the middle of her ring fingers. There was minor skin slippage to the front of her knees and to both of her front central portion of her legs. There were minor skin slippage to her inner upper right calf and to her outer lower left calf. There was skin slippage to the lower central portion of her back. On Sunday, February 12th, the water temperature in the bathtub was 89 degrees. On Sunday, February 12th, at 25 hours, the air temperature inside the living room was 67 degrees. On Sunday, February 12th, 31 hours, the descendant's liver temperature was 96 degrees. On February 12th, 2012, at 30 hours, I positively identified the descendant as Whitney Elizabeth Houston with the date of birth of 8/9/1963 by the photographer on her California driver's license at the scene. Next of kin notification. At an unknown time, friends notified daughter of her mother's death. I have not spoken with Bobby Christina at the time of the completion of this report. Please see case for further information. I did not discuss tissue donations with the descendant's family. Detective Hamon requires a 2-hour notification prior to the examination. Please see case notes for his information. These are all the pills she had? What are these pills for? Let's see what this is. AC-Fex. Let's see what AC-Fex is for. What is it called? AC-Fex. Let's see. Do you need a prescription for? Is AC-Fex still used? The Food and Drug Administration has determined that AC-Fex delayed release tablets, 10 milligrams, were not withdrawn for sale. That is a rabeprozole. It can treat heartburn, stomach ulcers, gastroflex, reflux disease. So that first medicine is for stomach. Let's see what this other one is. Alprazolam. Alprazolam. I'm saying for anxiety. The second one is for anxiety. I don't know. Some of y'all might know this. Let's see. What's this other one? Amox. What is Amox? Amox. She had two different type of Amox. Let's see what Amox is. Amox TRK. Amox TRK. Amazillin acid is a combination of penicillin type antibiotic used to treat a wide variety of bacterial infections. Oh, so that's an antibiotic. And what's this one? Dexamine. Dexamine Hansen. Dexamine Hansen. Dexamethasone belongs to a class of drugs known as cortisone, corticosteroids. It is used to help your immune system control inflammatory in your body. It may be used to reduce the risk of nausea and vomiting caused by cancer, chemotherapy. It's also used for several allergies, adrenal problems, arthritis, asthma, blood or bone marrow problems, kidney problems, skin condition, and flare-ups. So that's all the drugs she had. Okay, now let's see here. The paraphernalia descriptions. A white rolled up piece of paper, 2 pieces from a small plastic bag, 1 small spoon with a white crystal-like substance in one end. I wonder if they fucking drugged her ass with fentanyl or something. Let's see here. These are more drugs, medical evidence. She had Xanax. What's prednisone? Prednisone. Did I look that up right? Minocycline HCl. Minocycline HCl. Minocycline. Minocycline capsules are used to treat bacteria infections in many different parts of the body. It also used to treat anthrax infections and other infections in patients who cannot receive penicillins. Minocycline belongs to the class of medicine known as tetracycline antibiotics. That's for like gonorrhea and syphilis and shit. Minocycline is used to treat many different bacterial infections such as urinary tract infections, respiratory infections, skin infections, severe acne, chlamydia, tick fever, and others. It is also used for gonorrhea, syphilis, and other infections as a second line drug in those with a penicillin allergy. You find out this nigga was hitting her with some dirty dick, allegedly. What's this next one? Statin, 100 milligrams, I guess. Statin. Let's see what that is. Statin. What is statin used to treat? This medication is used to treat fungal infections in the stomach or intestines. God damn. What the fuck? Somebody gave Whitney some fucking, like, God damn, man. Niggas had some dirty dick going up in God, the Queen. God bless her soul. What the fuck? Nystatin treats thrush, a fungal or yeast infection in the mouth. Oh, God. It belongs to a group of medications called antifungals. It will not treat infections caused by bacteria or viruses. This medicine may be used for other purposes. Ask your health care provider or pharmacist if you have questions. Hell. These motherfuckers just made me stop wanting to kiss motherfucking women now. The fuck? Prednisone? Let's see what prednisone is. Yeah, I better start looking at motherfuckers' medicine cabinets and see if they got any of this shit in they goddamn, what you call it? Prednisone is a steroid medication that treats conditions like asthma, allergic reactions, arthritis, inflammatory bowel disease, and adrenal, blood, or bone marrow conditions. It decreases inflammatory, slows, and overactive immune system or replaces cortisol. What is prednisone usually prescribed for? Severe allergies, adrenal problems, arthritis, asthma, blood, or bone marrow, problems with eye or vision problems, stomach or bowel problems, lupus, skin conditions, kidney problems, ulcerative colitis, and flare-ups. God, Whitney was taking a lot of medicine, bro. And Xanax, I ain't got to look up Xanax. I think y'all know what Xanax is for. So here is, I guess, the preliminary examination report. I really don't know how to read that. That's some corners work. There we go. That's what I was looking for. For hypnotic findings and the pertinent history, I ascribe the death to drowning, effects of, I don't know this word, heart disease, and cocaine use. Let me look this word up. What is that word again? How do you spell it? H. Chlorotic. Atherosclerotic. There you go. What is, how do you pronounce this word? Let me see. Atherosclerosis. So atherosclerosis, heart disease, which means atherosclerosis, thickening or hardening of the arteries. It is caused by a buildup of plaque in the inner lining of an artery. Plaque is made up of the deposit of fatty substances, cholesterol, cellular waste products, calcium, and fiber. So y'all telling us Whitney Houston died because her fucking her fucking heart was clogged? Are you serious? Are you serious? They telling us Whitney Houston died of drowning and her heart was clogged with the cocaine use. Anatomy, let's see, history of substance abuse, perforation or posterior nasal symptom, atherosclerotic heart disease, 60% narrowing of the right coronary artery, pulmonary edema, mild, I don't know all these words. I don't even know what they mean. Congestion in the right colon, perimony and post-mortem scald burns, which means the water was too fucking hot. So how she drowned in some water was too hot? Y'all think she got in the water while it was scalding, boiling hot? Yeah, right. Somebody turned on that water after they threw her ass in that tub. Number 9, injuries. Contusion and abrasion on the left forehead. Y'all see that? Skull burn and sacrum. Abrasion on the left hand. Abrasion on the lower left leg. Superficial incisions on the upper lip, like somebody punched in her mouth. Resuccative abrasions of anterior chest. Mild fatty change of liver. Fibrosis, mastophy, See separate radiology, dental, microbiology, criminalistics, criminalistics, and toxicology reports. The sender is a 48-year-old woman found submerged in a bathtub that contained extremely hot water, 93.5 Fahrenheit at 9:35 p.m. per detective. She was pronounced dead at the scene by paramedics at 3:55 p.m. on February 11th, 2012. Come on, y'all. Y'all telling me she drowned in scalding hot water? She was taking a bath in scalding hot water, y'all. Sound like it was a fight to me. Sound like it was a fight to me. That water's too hot, bro. That's almost, what is it? When you got a person has a fever, a normal temperature of a fever. Let me see something. Normal temperature for a fever adult. 99.1 degrees means you got a fucking fever, bro. That's a low grade fever. 99.1 degrees. 99.1 degrees. And y'all telling me Whitney Houston was in the tub at 93 degrees taking a bath? That's niggas killed her and turned the fucking water on and make it look like she drowned. External examination. Something ain't right. Y'all telling me that they don't got footage of who went in and out of Whitney Houston room? Y'all telling me y'all can't see this? They ain't got no video of who went in and out her room. They don't got the assistant leaving and coming back. So about she went to Neiman Marcus that fast? Have you ever been to Neiman Marcus? You tell me that the assistant went to Neiman Marcus. And who's the assistant? We need the assistant name. Who was the assistant?